Okay, so for question 6, when IVF cycles are unsuccessful, what are some of the next steps or options patients may begin discussing with their doctor?
That's a really good question. Yeah. So in our pool of patients, when we're into the mid 40s or 43, 44, 45, and we're trying to weigh the pros and cons of the medications on your body, on your ovaries, your risks, and the statistical success, especially if both of us, like it's our egg and our age, and there's male factor where it's a combination of a limited number of eggs and potentially where the sperm isn't as optimized. So, um, we start to put in our plan of action, like 3 good tries, and then we might discuss opening up the conversation for a frozen or fresh donor egg. And that's a big step and it's a big thing to think through for anybody. And then occasionally it'll happen where even on the male side, they carry a autosomal dominant gene that's very challenging, and we have to actually have a conversation about donor sperm in light of circumstances and statistics, because autosomal dominant issues can pop up in every other embryo. And then when we're in our older age, it's harder to get a genetically good embryo. And so there's conversations with that. Um, Here we've had a few patients and it'll happen in a row where they've had a C-section and then had bleeding and had a hysterectomy, and their next pregnancy has to be with a surrogate.
Mhm.
Also, if we've had like lupus nephritis or these tougher health conditions, and it always feels like, why me? Why did this happen? But once you make it through the stages of acceptance, then it's good to think about the option. At least we have the option to think through of surrogacy. Also, sometimes patients are on a lot of psych medications or really worried for postpartum depression or anxiety, and it's a big thing, but we think about what to do. And in any circumstance, we try to have a conversation. If you've had many embryo transfers and the embryo didn't find the proper receptors to latch on, or there's other factors such as Asherman syndrome and things like that, then it's important to think about a surrogate too in those cases. So it's a very there's many different paths, but you want to keep an open mind and try to think about it. And discussing it. I today had to tell a patient it's just discussing. We're trying to figure out what's the best way ahead.
Yeah. And I'm glad you mentioned like the mental health aspect as well, and them being postpartum or on medications. That's another huge factor that I feel like doesn't get talked about nearly enough.
Mm-hmm. I know. Yeah, it's true.
Right. So for question 7, at what point do options such as, and we kind of, I guess, briefly talked about this, but options such as donor eggs or surrogacy become part of the family building conversation? I know you just said about after 3 tries when you typically bring it up. Is there anything you could add to that?
Sure. Yeah. Um, Sometimes if our FSH is over 40 on 2 occasions, that's like a textbook way to think about whether we should keep trying on your own ovaries when your pituitary is already trying so hard with the level of FSH to make your body ovulate. We've had patients with very high FSH levels get pregnant and get good embryos. So it's not impossible. It's just like trying to think it through. As well as if there's a issue or any health issue where you can't carry, or the maternal fetal medicine team recommends that it's for cardiac issues or other health issues, it's better to not carry the pregnancy. You can get good embryos and then prepare for a surrogate. But those are kind of the bigger picture causes.
Mhm. Gotcha. All right. And we'll move on to question 8. So, what are some important medical or practical considerations intended parents should understand before pursuing surrogacy or looking as an option?
Yeah, I think it's important to, like you mentioned, our mental health, but to discuss openly how you want to discuss it with your future child of in terms of the psychological discussions. I try to think it through with people as well. And then understanding that our goal for the surrogate is a healthy full-term baby. Singleton is the best, but I know sometimes people ask us, can we please put two embryos? But so we would discuss it, the pros and cons, but most of the time the goal is one healthy full-term baby. And then we really want the surrogates as, to be as healthy as possible. So exercising, eating right, making sure they're not on any medications that are not ideal. Look at their history and their family history and the history of their pregnancies and as well. We have a whole checklist that we go through.
Mhm. Be sure. Yeah. Awesome. Well, thank you for sharing that. And like you said, I think the mental health part, and that's something that in our program you will talk with a psychologist when you join, before moving forward, just to make sure, talk about, like you said, what do you want to tell your children, do you want to tell them about the surrogacy? Like, how do you want to move forward with that? So, those are definitely stuff to consider.
And of course, for the surrogate, her uterus, for
Mhm.
the saline sonogram or whichever avenue to verify that the inside wall is smooth and that she's on her prenatal vitamin for 3 months ahead to prevent spina bifida. There's a lot of steps involved with the medical and practical considerations.
Yeah, she's reviewed by you guys before, but
Yeah,
being considered ready to be a surrogate, right?
exactly. Yeah.
So for question 9, are there certain situations where surrogacy may provide patients with a safer or more effective path to parenthood?
Yes. And in some cases where a patient may have a health condition that is puts the mom at risk for during pregnancy, such as an aneurysm or a certain cardiovascular issue or lupus nephritis or any specific health conditions. Um, and as well as, like we talked about, if you've had prior postpartum where it was very severe, sometimes that's a reason because that could occur again. Um, I mean, there's a whole long list. Medications is a lot too. We had a patient on methotrexate where she feels like fantastic on it for her rheumatoid arthritis, but you can't be on that to try to get pregnant. So it's a tough conversation to think through whether to stop it and have possibly a resurgence of the issue or consider surrogacy too.
Mhm. Yeah, all right. Well, let's move on to question 10. So, what are some common misconceptions patients have about the donor eggs or surrogacy in general?
I think what's fascinating is epigenetics. So all of us get a chromosome from our both our parents, and certain changes on the chromosome, such as methylations or histone issues or DNA, different little changes. That's why our siblings are different. I'm the oldest of four, and we're really different. So it's interesting to think during pregnancy what nutritional things, what toxins, what stress, sleep disturbances, all these different things can influence epigenetics. So I think that's important to think about. Also, in the human egg, we're all relatively very similar, but when we look at, um, height, weight, race, ethnic background, our appearances and things, those are some differences, but how we nurture in our environment when you're raising the child makes a big difference with all the cognitive things and the goals that you have for your family. Um, I I also think I try to mantra to myself that my goal is a healthy full-term baby. And so I tend to see a lot of patients who are in their mid 40s who realize now I really, really want a chance. Please give me a chance to try with my own eggs. And I put myself in their shoes and I do think I want to give a chance. But then at the hard part is the chromosomes get sticky when we get into our 40s. And that's why there's the risk of the extra piece of a chromosome, which is can be unhealthy for a pregnancy. So I think there's a couple misconceptions. I noticed the partners have a different misconception in a sense of different things than per se us, but so I think also I tell people write out your fears and tell me what are the fears because I'm always a little interested to know that it isn't what like I'm thinking as the doctor to be afraid of. Their fears are different
Yeah.
than what I was thinking. Like they're afraid of an ectopic, and I'm like, we don't see that very frequently, but it happens occasionally, but it's pretty infrequent. So I wouldn't put that as a top fear, you know.
Yeah, and that's yeah, it goes back to like personalized care is instead of just going over the general like concerns, you ask them first like what you fear the most and you can personally address it. So yeah, that's great.
Yeah, I think a lot of people worry what the surrogate's going to eat, but I always say they
Mhm.
already had two full-term healthy kids. They're getting good grades. I ask them, how are your kids doing? Are they getting good grades? All this stuff. And sometimes they'll bring the kids and I meet them. And so I always think to myself, they're probably being as healthy as they can be. So that's also helpful to know.
Yeah, that is especially surrogates, like mothers, that's one of the big things that's talked about a lot in the meetings is like the diet and their daily routine, which I completely understand. If you want to find a surrogate, you want to make sure they have a healthy lifestyle.
Yeah, for sure.